and she is joined by Ann Hedgepeth, who's our Senior Director of Federal and State Government Affairs, as well as Jake Stewart, who is our Federal Policy Analyst. So I'm going to turn it over to you, Amy.
Thanks, Sarah. Hi, everyone. Thank you so much for joining us this afternoon. We are thrilled to be able to gather you, and I'm very, very excited for this team to be able to walk you through what to expect with this request for information from the Administration for Children and Families. I know many of you have had a chance to work with Jake and Tony. You may not have had a chance to meet our brand new Senior Director of Federal and State Government Affairs, Ann Hedgepeth, who we're very excited to have on board, and she is going to lead the team in walking through ways in which we can help you get ready to respond to this request for information. So thanks again for joining us, and keep those questions in mind and enter them in the chat box as they pop up.
Awesome. Thanks, Amy. As mentioned, I'm Ann Hedgepeth, the Senior Director of Federal and State Government Affairs, and I am the newest addition to the Policy Research and Programs team here at Child Care Aware of America, providing technical assistance to support your efforts to engage with policymakers in today's case with the Federal Administration for Children and Families, or ACF, at the Department of Health and Human Services, is a really exciting part of the work that I get to do here. And I hope today's conversation will be helpful to your advocacy. So we're going to start by talking a little bit about what a request for information is. And while many of us are old hands at navigating the process by which agencies govern through regulations and guidance, it can be complicated. But one of the great advantages of regulatory action is that in so many cases, everyone can participate. Things are open to public comment, which we should take advantage of. This section of the webinar is designed to help you all understand what specifically a request for information is and what it's not, and what is in this particular request for information from ACF. In so many ways, a request for information is very self-explanatory, but there are other pieces of information that are helpful here and that we wanted to share. And all of this will feed the overarching strategy and message for what comments in response to the RFI should include, which we'll be sharing later in the presentation. So let's talk a little bit about an RFI. Agencies use requests for information to do a few things. One of those things is to hear from a diverse set of stakeholders. This can bring forward information that an agency did not previously have. It can bring forward new research that is available, or even data that can be helpful to policymaking. In addition, agencies hearing from diverse stakeholders can help them take the temperature of communities on policy concepts. We'll talk more about this later, but this is one of the main reasons that we're encouraging you all to submit comments on this particular RFI with the resources that we'll provide. It's going to be helpful for ACF to understand the temperature of the community on things like the price of care and deregulation, things that they ask about in the RFI, and things we want to make sure we submit information about. Another element of a request for information is that they allow an agency to begin to build a public record on an issue. Everything that's submitted as a part of an RFI becomes part of the public record. This means that an agency can draw on it and point to it in the future actions that they take. And it also means the same is true for groups and external stakeholders. We can help create a public record that can be relied on in the future, showing support from diverse partners on a particular policy, or collecting and submitting key research on the issue. Finally, a request for information can foretell or kick off agency action like a future rulemaking or issuance of guidance. It's as close to a crystal ball as we're going to get, with clues about what an agency might want to pursue depending on the stakeholder information that they get. One thing that a request for information is not is new regulations or new policies. That's good news because it means that where there's language in an RFI that we might not love or that we want to help explain some nuance around, we actually have that opportunity through the comment period on the request for information. Nothing in here is actual new policy yet. And since it isn't yet a formal rulemaking, I do also want to mention that in responding to a request for information, we also can't have the expectation that an agency will do anything with the information we submit. That's important to keep in mind, and it's something that we considered when we were thinking about the length and the breadth of comments that Child Care Aware of America is going to submit on this request for information. In more practical terms, while we could all write a thesis on these questions and summarize all the amazing research and practices and policies out there, I want to keep in mind that we're early in any sort of a process right now, and we're going to get many more opportunities to weigh in if an agency were to decide to move forward with a formal policy or rule change. But submitting comments on this RFI has the benefit of sharing our worldview with ACF and preparing us to weigh in on any policy changes that might come from this RFI if they're ever proposed. And those are great reasons to put something together and to weigh in at this stage. And it's why we wanted to talk to you all today and provide you resources tomorrow to help make that happen. So now I want to talk a little bit about the specifics of what's in this RFI. ACF is seeking public comment on a few overarching questions. First, they're looking for help identifying emerging and innovative practices to improve access to high-quality care, with an emphasis on identifying regulatory and other policies that unnecessarily drive up the cost of care or limit parents' choice of different child care options. In addition, they're hoping to identify ways to improve funding of childcare and early education programs to support quality and create more streamlined, equitable, and sustainable financing frameworks. Some keywords here, which have been underlined on the slide, are things like the cost of care, parent choice, streamlined, equitable, and sustainable. These are good themes that we're going to come back to throughout our conversation and for you to keep in mind as we talk about writing comments. ACF boils these overarching themes down into 5 more specific buckets or questions. We've labeled them here on the slide the way that ACF does in the request for information. Jake is going to talk more about this when we get further on in the program, but it's smart to include the question numbers in your comments. So we wanted to make sure that we provided those throughout and here. So the numbering reflects what's in the actual request for information. So the questions that ACF asks are, under an umbrella of improving access to affordable, high-quality childcare, how can we build the supply of childcare? How can we improve childcare regulations? How can we cultivate the childcare workforce? And how can we develop better childcare business models? In addition, ACF includes a question around transforming financing of childcare and early education programs. What really stood out to us here at Child Care Aware of America is the inclusion of a question about improving childcare regulations. In the RFI narrative itself, the agency asked for more information on, and these are their words, not mine, regulations that are, quote, duplicative, inconsistent, and or unintentionally driving up the cost of providing care, reducing availability, or pushing different types of providers out of the market. We know from other conversations and public-facing information from this administration that eliminating regulations is a high priority for all agencies. Given that information and what's included in the RFI that I just shared, it's important for stakeholders to weigh in and address this question. Specifically, we are hoping to provide a different narrative for ACF to understand the importance of regulations, that the link between regulations and supply is murky at best, and that an investment in the system is needed. We have numerous resources to back up this point and others that would be valuable to include in comments in response to the RFI. And for all of this helpful information, details on how to submit comments, and what to expect from us in the way of templates and resources, I'm going to turn things over to Jake.
Thank you so much, Anne. And just as a reminder, before I get into key messages and discussing the resources, I just wanted to remind you all that we will be sending all of our resources out in a follow-up email. So I don't want you to feel pressured that you need to get every note taken during this presentation, because we will follow up in providing you the slides in addition to the resources that you'll see here today. But first, I want to talk about some key messages that we suggest putting into any comment on this RFI. First, and probably one of the most important things, is to highlight your expertise and credibility on this issue and lift up any existing resources that you have, whether those are state or local resources. It's incredibly important for your voices to be heard in this RFI. It cannot and should not just be the voices of national organizations chiming in. And in fact, I think a large priority and emphasis will be on your perspective, because you do bring in that state and local perspective to the conversation. This is also a wonderful opportunity to highlight CCR&Rs as part of the solution when it comes to addressing all aspects actually of this RFI, not just regulations, but the other components that Anne had laid out earlier. So we highly encourage you to put in your comment all of the wonderful things that you do as a CCR&R, and really highlight how those actions can really be helpful in achieving what the RFI is aiming to achieve. You can cover all of the main issues if you'd like, but you can also just highlight one or two issues. That's really up to you. But really, our main suggestion is to not get bogged down in the smaller details of the RFI, as Anne mentioned earlier. If you read through the entire RFI, you will see that it really touches on a lot of aspects of childcare in this field, and we could probably write a 100-page research paper on, every aspect that it touches on. We highly recommend just focusing on the main aspects, and when you see the template that we give you, you'll see that we in Child Care Aware of America, in our comment, we do go by the main sections, but we don't get too much in detail, and instead start getting more in detail when it comes to the regulatory pieces, as Anne highlighted earlier. Finally, we suggest that you be clear on your stance for the regulatory piece, which is section A2. And our suggested message is that regulatory policy should not be tied to the overarching goals of increasing the supply or reducing the cost of high quality care. And we'll go into more details about that here in a moment. This is a list of just some of examples of targeted requirements, not necessarily targeted in the RFI itself, but targeted within the conversations in the federal discourse on childcare. It includes ratios, infrastructure, specifically zoning laws and other infrastructure requirements, background checks, which we know has been a large talking point across many states, and even nutrition standards, because there have been conversations about nutrition standards being excessive. Of course, this is not an exhaustive list. This is just a few examples of the requirements that we've been hearing about in the federal conversations. And also, these aren't necessarily independent. We know that, for instance, the ratios and the background checks examples can get intermingled, and same with infrastructure. And we know that there's more depth to these as well, but we just wanted to highlight a few of the requirements that might be at the top of the minds of the agency while they're reading through the comments. Now, going more deeply into the regulatory piece, or section A2 of the RFI, we wanted to highlight some of the regulation myths that are currently being discussed within the federal conversation on childcare. First is that the myth that regulations are decreasing the supply of high quality childcare. And the second is that regulations are the primary reason for the increase in cost and price that we're seeing from year to year. Given that these are the two primary myths that we're hearing about, we outlined three primary goals within the comments for this RFI. First is we want to discredit the myth that regulations are the primary cause of the decrease in supply or the increase of the price of high quality care. We want to highlight why the key requirements matter and why requirements such as ratios are crucial for the safety and well-being of the children that are in care. And finally, we want to make sure that we're providing solutions, that we're not just tearing down the argument of regulations, but we're also giving solutions such as public investment, increased workforce support, and of course, CCR&Rs who often fill in many of the gaps that states are seeing, although many are also underfunded, making that difficult to do so. So now that we've talked about a couple of the key messages, I want to go over just some resources that we have for you in helping guide your comment on this RFI. The first resource is a one-pager that we recently released on the topic of deregulation. And in fact, it's only been available on our website for a few weeks now. And in this one-pager, which you see pictured here, you see the front side pictured here, we go over a few important details. First, we highlight the decline in child care providers, specifically noting the decline in family child care providers. And we talk a little bit about the primary causes of that. Of course, we do highlight the low wages of child care providers as well, which we all know is a large contributing factor to why providers are leaving the field or prohibiting new providers from joining the field. And of course, we do discuss and we recognize that requirements and regulations can be very difficult to navigate, especially for family child care providers. So we did make a formal recognition of that. I just want to note that in the online version of this one-pager, which we will provide you the link for, we do cite our sources at the bottom of that one-pager. So if you're interested in following up on any of the statistics that you see presented in this, you can just go to those references and follow up, and we have more detailed reports on those as well. The backside of the one-pager is really what I want to highlight here, because we have a couple of, we go into more detail to explain why it's actually not regulations and requirements that are contributing to the decline of providers. First, in the upper left-hand corner, we talk about what we describe as a deregulation paradox in childcare, and that's an analysis that we did where we looked at states on both ends of the spectrum, of the licensing spectrum, so states that allow for unlicensed, unregulated care, and states that actually don't allow for unlicensed, unregulated care. And we did a comparison of the rates that providers are leaving the field every year in each of those. And we found that there does not seem to be any sort of correlation between states that allow for unlicensed care and states that do not allow for unlicensed care. And in fact, the states that do not allow for unlicensed care seem to have lower than average rates of family child care providers leaving the field. Additionally, you're going to see at the bottom there, we have a graph, and this one is really important because it really goes back to the correlation between providers leaving the field and requirements being added. And we provide data, and this comes from our state fact sheets report that we released over the summer. And this is the longitudinal data of family child care, the number of family child care providers, specifically CCDF family child care providers, over the last 8 years or so. And you can see that starting in 2009 is really when family child care providers began leaving the field. And a statistic we cite is that in the 5 years before 2014, or the reauthorization of CCDBG, we saw that number declined by 40%, and that was before CCDBG was even reauthorized in Congress. And so that really dispels the myth that it's the increased regulations and requirements that are leading to the decline of child care providers. So, and then of course, after that, we list what we call the right way to improve supply, which is really a large scale investment in the child care workforce. And we list a number of recommendations there. So this is a document that we encourage you to refer to or utilize when it comes for your own talking points in the RFI. The second resource we wanted to highlight for you has to do with our price of care reports. And the reason why we wanted to talk about our price of care report, which of course is mainly because it's cited as our report is often cited as a reason why we should deregulate, because a lot of policymakers are noting that the price of childcare is unaffordable and is out of reach for many families, and because it's unaffordable, it's cited as a reason to deregulate. However, of course, we would like to note that there is no discernible increase in price tied to regulatory policy. We have been doing this report for 13 years. We have individual state data for all 13 of those years, and we have not seen any sort of discernible bump in prices as the result of regulatory policy at the federal level or at the state or local level. Now, that is not to say the price of care is not increasing from year to year. It is definitely increasing. But it would be incorrect to say that because of regulations and requirements being added, that the price for families has necessarily gone up. The second point that we want to guide you to is the policy recommendations in our report, because in our own report, we are very clear that the primary goal of policymakers should not be to try to reduce the price of care, but rather supporting the workforce and helping families pay for care. And what you see here is a model that we created regarding the way to think about policy and really addressing those two components of supporting the workforce and helping families pay. Within the report itself, we then go into more detail about what policies look like in each of those buckets. But we created this model specifically to help guide policymakers' thinking and to steer them away from this goal of trying to think of policies such as deregulation in order to reduce the price of care. We have additional resources from Child Care Aware of America as well. So we have our state fact sheets, which were updated just last June. So for each state, we have data not only on the number of programs, but also the types of programs that are available in your state. And again, we have those from year to year. We have our Mapping the Gap initiative, which has currently mapped in 10 states, but we also have the Closing the Gap report. The reason why I started that one is because that one really highlights why CCR&Rs are a really important solution when it comes to the child care supply crisis. So for more talking points to discuss why CCR&Rs are important for this entire conversation, that is a resource we would definitely recommend. We have It's About Time, which is our report about the availability of non-standard hours care. Also in this report, you will see that we do have a section dedicated to CCR&Rs and their efforts in helping increase the supply of high quality non-standard hour care. We have our Paths to a Healthier Child Care Workforce report, as well as our CCDBG state snapshots, which came out in June of this year. And so those are snapshots of each state, highlighting not only how states have used the recent increase in CCDBG, but also why there is still a need in each state and what increase in funding looks like for each state. And then finally, we have our Leaving Children to Chance, which is our licensing rankings that we've done. This is actually going through an update right now. Some of you may have been involved in this process over the last year or so. And by the end of 2020, we actually plan to release our update of that. But for now, feel free to refer to that for your comments. We also wanted to highlight just some other resources that we found useful in drafting our own comment. First is the Caring for Our Children Standards and Justifications, which I believe many of you are familiar with. I'm sure a lot of you have heard of the Heckman study that is on the return on investment in high quality childcare. So to really highlight why high quality matters and the return on investment in that. On similar lines, the Perry Preschool study on the lasting impacts of high quality, which really also emphasizes societal impacts such as reduced crime rates and reduced healthcare costs for society. But really, and most importantly, I would say, is your own state's data, studies that maybe your organization or your state has commissioned, and of course, your own state's history. A lot of you are obviously very familiar with your state's history when it comes to policy, and your state may have recently added a regulation or requirement, or maybe even taken one away, and you can really speak in more detail about the impact that that's had on your state, and really discuss further about the correlation and the suggestions you have from there. So now, moving on to the steps for submitting your comment. This is just highlighting the important information. First is, as mentioned, the deadline is December 2nd to submit your comments. There are two ways that you can submit. You can either use the federal e-rulemaking portal, which is the method that we prefer and that they prefer for you to use. And so that's just a simple link, and they have a very easy to use portal, which I will show a screenshot of soon. Of course, the second option is that you can mail those to the Office of Child Care. Again, just reiterating that we are going to be providing templates, instructions on how to submit your comment, as well as links to resources in a follow-up email tomorrow. And just highlighting that all submissions need to have the agency name, so Administration for Children and Families and the Department of Health and Human Services, as well as the Regulatory Information Number, or the RIN. Our template will have those already there for you. So don't stress out if you want to use our templates. It will already come preloaded with that information. So speaking of, this is just a snapshot of the working draft of what our template would look like. As you can see, we kind of have starter language there for you. Do not feel like that starter language has to be the final language. It's just to serve as a foundation. You're welcome to change whatever you would like to change. We have the heading there for you and everything. And of course, we will highlight and explicitly show you where to make changes in order to match and meet your organization's needs. And as far as format goes, I know a lot of people always have questions about what the format needs to be for this comment. I will first say that there is no required format. And so I just wanted to give you an example of how we formatted our own. And again, this is a working draft, so please don't share this. This doesn't necessarily reflect the final language. But you'll see here that we explicitly set aside each section. We actually bolded the section title reflecting the RFI section, and we really matched the RFI in terms of how they laid out each primary point and subpoint. So you can see here we explicitly showed where we're talking about A1, building the supply of high quality care, and then continued on with our comment. I also wanted to highlight that the resources that we included within the comment, we reference in the footnotes. Just the way that they're receiving comments, hyperlinking into your document isn't necessarily going to be effective. So if there's any research that you're utilizing, especially if it's your own research or your own data, we really encourage you to make sure that you reference that so that those who are reading the comment can be able to access those resources as well. Of course, we went section by section, but we actually ended up saving the regulatory section as the final section because this is where we spent most of our time when it came to drafting our RFIs. So you'll notice that we explicitly, again, made it clear that we were concerned about this portion of the RFI, and then we moved this to the final portion of our comment. So you don't have to do that. You can use whatever organization method best suits you, but we just wanted to give you an example of our own, just as a guiding point or a starting off point. This is this screen grab of the portal that ACF uses, and actually all agencies use when it comes to comments. See that you can submit your information. We highly recommend that you just save your comments. You can save it as a PDF, and then you can just upload it as I highlighted there on the screen. Of course, if you wanted to just directly input your comment into that text box, you are more than welcome to. But we just want to make sure, I think it is important to have high quality comments, and I think higher quality comments are more likely to be uploaded than they are to be typed into the comment box. So as far as next steps go, as mentioned, all webinar attendees will receive a follow-up email with all the slides that you see here today, the resources, links to those resources, the templates that we mentioned, as well as instructions for submission. We encourage other relevant state or local stakeholders to comment, particularly those with really good perspectives on requirements. So if you know of other people in your state or in your community that you really want to encourage to comment, we encourage you to reach out to them. And of course, if they also need any starter resources, you're welcome to utilize our starter resources, just understanding that we do come from more of a CCR in our perspective, but we do have plenty of resources that can also help them. So we encourage you to reach out to your networks to comment. And just again, reiterating that all comments are due December 2nd. So make sure that you comment when you can. In the final slide, you are going to see my email address as well as Anne's email address. So of course, if you have any questions that are not answered in this presentation, or if you have any questions in between now and the final date of submission, you are more than welcome to reach out to us, and we're happy to help guide you through the process as well. And that's it. So I think now what we're going to do is move on to any questions. As mentioned, if there are any questions, please feel free to type them into the question box. And so let me pull up and see.
While we're checking out the questions, this is Anne. I wanted to chime in and share with y'all that we'll also be making it clear how if you have individuals, families, parents, and other people in your network who may not be well positioned to write a institutional comment, so say on the behalf of an organization, but may have an important story that could be impactful in the conversation about regulations and about policy changes that ACF may be considering. We'll also be including in the resources we distribute to you all a way that people can go to Child Care Works, our website with advocacy opportunities, and submit a comment there as well with their individual story and some of these same messages that we're all going to be delivering about the importance of investment in the system and about the importance of high quality childcare and how regulations undergird that entire system. So just wanted to let you know that that will be another outreach opportunity that we share with you all, that I hope that you'll share with your networks to communicate the importance of engaging in this form of policymakers and an easy way for people to take action in this space. You can also utilize that portal, but as Jake mentioned, we know you have a wealth of information from an organizational perspective that might be better suited to comments that are prepared with some citations and some research and some of the resources that you have. So that's why we'll also be making sure that you have access to a template that can be utilized in that way. Hopefully this is a way for a lot of different stakeholders to contribute to this conversation. And that's the goal of ours, is to make that as easy as possible.
All right, so just going over some of the questions. Once again, you all are still welcome actually to enter in some questions. I'm kind of grouping some questions together, but there are some questions just asking about the when you're going to be receiving the resources. So you should be receiving an email tomorrow, a follow-up email that has the slides that you saw here today, as well as links to all of the resources and the templates and the instructions for submitting your comments. So that should be coming tomorrow. If for some reason you do not receive that email, be sure to check your spam folder, but of course, reach out to one of us and we will try to get you those resources as soon as possible. But it should be coming by the end of the day tomorrow. We have a question about whether or not where comments need to be submitted to. We encourage you to submit them directly to the Administration for Children and Families. So we encourage you to use the portal and directly submit them there. However, if you want us to look over the comments, or if you want additional feedback, or if you just have any questions about your comment, you're welcome to use us as a resource. But we do encourage. It looks better if they're hearing directly from you as opposed to from us. But we will be submitting our own comment as well.
And this is Anne. I'll just chime in and add that if you're having any challenges with the regulations.gov portal and utilizing the instructions that we send on tomorrow, that's another opportunity for you to reach out to us. We're happy to provide some technical assistance there, and Jake and I are both available to make that happen. So we understand that submitting things directly can take a couple extra steps, but we do hope that that means that your comments get in and are utilized by the agency.
And I'm seeing some additional questions about regarding other types of research. So for instance, we didn't really go into research regarding nutrition standards in this presentation, mainly because that is not necessarily our field of expertise. However, we do encourage you to talk about whichever standards you feel are important. So feel free to try to access those resources. I know that FRAC, the Food Research and Action Center, has great resources when it comes to the nutritional element. I know that there are other requirements and portions within this RFI that we did not have time to go in depth on. But I think what's most important is that those issues that are salient for you and that are salient for your community are the issues that you should be speaking in depth on. I don't want you to steer you in a direction where you need to cover all these issues where there's the salient ones from your community. And most importantly, I think those are the ones that are going to give your voice the most strength as you write this comment. And so just make sure that you're choosing the ones that really are the most important to you, and you're encouraging others to chime in as well.
And hopefully you heard in the content we shared today that there are some underlying driving forces behind the actions that ACF is taking right now, including this request for information, and that might not be abundantly clear just by reading the request for information. And so seeing some of the extra intel we have and the strategy and messages we're recommending, we're hoping that you'll be able to carry that framework forward into your comments, even as you layer in, to Jake's really important point, your expertise, local issues, or other challenges that you think are relevant to the conversation. So this opportunity to comment can do a number of different things when it comes to our policy and advocacy strategy, address a big picture challenge that we see, a narrative that we want to make sure we provide additional context for, as well as really specific information to this experience that you're having and the things that you're seeing in your communities. It's a great opportunity to do that if you're able to contribute.
So summarizing a couple of other questions here, some of you are pointing out that there are aspects within CCDF or recommended aspects from the federal government themselves in order to address exactly what the RFI is seeking to accomplish. And you're exactly right. I think it's a very strong argument to point out that there are federal recommendations, such as ensuring that no families are paying over a certain amount for the cost of care, that are still not being met or unable to be met by a variety of states because of the lack of funding or the lack of time to get these requirements in place. And I think there is a strong argument that there are some things that are merely recommendations that maybe should be even stronger than they are laid out. So I think it is highly appropriate to go back to the CCDBG requirements, the justifications for those requirements. I think the final rule actually, which I know a lot of you are familiar with that long final rule, but it really goes into detail about the justifications for those requirements, and I think could easily provide a lot of talking points. But really, states have not had enough time to really enact the requirements. So perhaps it is inappropriate to already talk about, lowering requirements when we haven't even seen the results of those. So thanks to those who have pointed them out. And yeah, just again, I want to highlight that you are welcome to utilize our resources and also share our resources in the summary of the RFI today. You still have plenty of time to draft a comment and submit a comment, and we are here to help in any way that we can. So we will give it, anyone has any other questions?
Great, and I just want to remind folks a few of the things that we'll be sharing with everyone tomorrow. We have heard in the questions that it would be helpful to make sure that you have a link to the original request for information so that you can read it, and in case it didn't make it to your inbox the first time around. We'll be making sure to include things like a template, the information from this presentation, instructions on how to submit your comments, and these great resources that we're hoping you'll include in whatever you submit. We are hopeful that those things will make it easy for you to participate in this request for information, and Jake and I are available to answer any questions you may have as you move through the process.
All right, I'm not seeing any other questions, so we will give you back some time, but of course, as Anne mentioned, you're welcome to reach out to us, and we're happy to answer any more questions that you have. But otherwise, thank you so much for attending today's webinar, and we hope that you guys are able to comment.
Happy commenting. Thanks again.